All right, let's get to real world. Okay? It's nice to have theories about how Thomas Jefferson said this and the Constitution is wrong about that, and we're enriching a worldwide banking cabal, and we don't have genuine freedom because bankers. That's all well and good. One of the things that happened this past week when the exchanges officially opened is we had a better sense and a clearer sense of the numbers involved in the Medicaid expansion. The biggest component of Obamacare, really there's two big components. One is of the Affordable Care Act, whatever you want to call it. One is the expansion of Medicaid. Essentially saying to 25, 30 million people who are too poor to buy insurance that you are now eligible for Medicaid. The other is a series of regulations on insurance companies basically saying you can no longer offer crappy products. Let's focus for a moment on the Medicaid expansion. This part of the law was essentially struck down by the Supreme Court. In other words, states now have the right to opt into this expansion of Medicaid under a very strange theory that somehow they were being coerced into doing it, or that it would be coercive. Because if they didn't accept the expansion of Medicaid, they wouldn't be able to get the original Medicaid. So under the Supreme Court's theory, if the original Medicaid had covered everybody up to 133% of poverty, and a state didn't want it, that would have been fine, and they would have gotten no Medicaid. But because this was amended after the existence of Medicaid, somehow that was coercive. If that doesn't make any sense to you, then you're like most people, and most in the legal profession who are completely shocked by this ruling. The implications of this are that many states rejected the expansion of Medicaid. And they are virtually all, or those who have definitively rejected it, Republican-led states. New York Times reports today 2/3 of poor blacks and single mothers and more than half of the low-wage workers who do not have insurance in this country will be ineligible for health insurance because of these Republican-controlled states that have refused to accept the expansion of Medicaid. There are 8 million Americans who are impoverished, uninsured, and ineligible for help. The federal government will pay for the expansion of this Medicaid completely, 100% for the first 2 years, and at a figure of no less than 90% going forward into the future. So we're talking about 2 years out, states would have to pay no more than 10% of the costs of providing insurance, health insurance, to people living between 100% and 133% of poverty. And these people cannot get covered because as it was written, the Affordable Care Act does not provide subsidies for people who are living 133% below the poverty line. Because there was an assumption that Medicaid would cover them. So if you're living at 140% of the poverty line, you can go into the exchanges and you can get subsidies. If you're living at 399% above the poverty line, you can go into the exchanges and get subsidies. You can also go into the exchanges if you're living above 400%, but you will not get subsidies. But generally, the price of insurance will be lower in most states and for most people. For some people, it would be higher. They tell the story of an unemployed healthcare worker in Virginia. She wouldn't identify herself because she doesn't want potential employees to know that she's down on her luck. She's 55 years old. She has high blood pressure. She's been waiting for the law to take effect so she could get coverage. She made a fatal mistake, however. Because before she lost her job in her house, she had to move in with her brother in Virginia, moving from Maryland. Maryland has expanded Medicaid. Virginia has not. Would I consider moving back there? It might involve me living in my car. I don't know. I might consider it. There are 26 states that have rejected the Medicaid expansion. They are home to half the country's population, but 68% of the poor. Of poor, uninsured blacks, and single mothers. About 60% of the country's uninsured working poor are in those states. Among those who are excluded are about 435,000 cashiers, 341,000 cooks, 253 nurses' aides. Now, the question I would love a libertarian or any conservative to call in and tell me is, why should we not provide health insurance for these people? Why shouldn't we? What is the value of a society if we can let millions of people live in abject poverty and not even provide health care for them? What is the point of society if we can have hundreds of thousands of people working and they cannot afford health care? Is that the answer? Is it freedom? Because that's what Thomas Jefferson would have wanted? You have millions of people who have been left out of this expansion because of Republican governors. New Hampshire, Ohio, Pennsylvania, and Tennessee still might decide to expand Medicaid coverage before the coverage takes effect in January. It would obviously affect the numbers I just said. Here's a story of Willie Charles Carter, an unemployed 53-year-old whose most recent job was a maintenance worker at a public school. He's had problems with his legs since surgery last year. His income is below Mississippi's ceiling for Medicaid, which is about $3,000 a year. But he has no, I'm going to repeat that. Mississippi's ceiling for Medicaid right now is $3,000 a year. But he has no dependent children, so he does not qualify. His income is too low to make him eligible for subsidies on the federal health exchange. You got to be almost dead before you can get Medicaid in Mississippi, he said. He does not know what he'll do when the clinic where he goes for medical care, the Good Samaritan Health Center in Greenville, closes next month because of lack of funding. I'm scared all the time, he said. I just walk around here with faith of God to take care of me. I guess that's what's called, that's what freedom is.
And faith.
For adults with children, the median income limit for Medicaid is just under half the federal poverty level, $5,600 a year for an individual. In states that are expanding, it's above the poverty line or at about $12,200, according to the Kaiser Family Foundation. In all, 6 out of 10 blacks live in the states not expanding Medicaid. In Mississippi, 56% of all poor and uninsured adults are black, even though they account for just 38% of the population. You remember Martin Gillen's book on why we hate welfare? There was no problem with welfare in the American public's consciousness until the Civil Rights Act of 1965, when racial animus became the driving electoral force for the Republican Party. And guys like Ronald Reagan and Rush Limbaugh started talking about welfare queens and pimps and the urban cities. Claretta Briscoe earns just under $11,000 a year making fried chicken and other fast food at a convenience store in Hollandale, Mississippi. Too much to qualify for Medicaid, but not enough to get subsidies on the new health exchange. She had a heart attack in 2002 that a local hospital treated as part of its charity care program, which you should know, the cost of which was certainly passed on to everybody else who went to that hospital. The cost of which was passed on to the government. So we paid for that treatment. We just didn't pay Medicaid rates. I skipped months on my blood pressure pills, she says. She visited the Good Samaritan Health Center last week because she was having chest pains. I buy them when I can afford them. That Samaritan Center will be shut down. She's 48. Gladys Abrilla, a housekeeper in Houston who earns $17,000 a year and supports 2 children, is under the poverty line and therefore not eligible for new subsidies. But she makes too much to qualify for Medicaid under the state's rules. States can set up their own rules. The 133% was supposed to be a catch-all for anybody whose states were not providing health insurance under Medicaid. She recently spent 36 hours waiting in the emergency room for a searing pain in her back. We came to this country, we are legal, and we work really hard, says Miss Arbila, 45. She immigrated to the United States 12 years ago. Her son is a soldier in Afghanistan. Why don't we have the same opportunities as others? Why? Because of freedom. Because it's like sugar. It's going to create a certain dependence in you.